Welcome and good evening, everyone. Welcome to the 2023 USMLE Step 1 Tutor Series hosted by TrueLearn. Tonight we'll be continuing the tutor series with session number 2. This is titled USMLE Step 1 Prep, Beyond the Basics. To actively participate in the event, please use the chat feature located on the right-hand side of your screen to post any questions for tonight's presenter. We will collect all questions and do our best to address them at appropriate times throughout the session, as well as during our Q&A segment near the end. Now, we'd like to welcome back our presenter, Dr. Chris Carrubba. Dr. Carrubba is the Medical Director of TrueLearn's USMLE Smart Banks and has over 12 years of experience in USMLE and complex tutoring, question writing, and content development. Dr. Carrubba, the floor is yours.
Thank you. And welcome back to everybody that came to the first session, and nice to meet you for the people that are coming for the first time today. The goal for this session is to really cover some of my favorite test taking tips and to try to make you just a little bit better test takers and give you guys a framework that you can carry forward and that you can start practicing. And, before we get started, I just want to reiterate how important it is for you to start practicing now and to really start thinking about how you're going to study, how much time you're going to spend. We've actually seen that since making the transition to a pass-fail test, the pass rate or first-time pass rate for step 1 has actually went down. More people are failing the test. And, I think there's a lot of things that go into that, be that people, rushing a little bit, not being as prepared. But I think the biggest takeaway is that you still need to take the exam seriously, and it's not too early to really start thinking about how do I want to study, what question banks are best for me, and how can I make myself a better test taker. And I really hope that by the end of today, we can give you some of that, piece and help you be a little bit better of a test taker. And, I always like starting with this. And, when you think about really any multiple choice test, but, we'll just focus on step 1 today, there's actually a few ways you can answer a question correctly. The easiest is you just simply know the answer. They asked me what's the mechanism of simvastatin, and I know what it is. The hardest and the least likely to be successful is just guessing. Hey, I've got no idea what's going on, and I'm going to pick C. And then there's a middle ground in there as well, where you can use existing knowledge combined with some of those test taking skills to really work towards the right answer, even if you're not 100% certain, what that's going to be. And at the end of the day, nobody is going to always be in that easiest category. There's just too much stuff on the exam to do that. You are not going to be in a position where you definitively know the answer to every single question. So I think that the best scores are when people are able to combine a good foundation of knowledge with a good foundation of test-taking skills, and that's going to make it so really every question they put themselves in a position where they have at least a good chance of answering that correctly. So we're going to really work through 5 big skills today that I think everybody should have. And then from there, we've got a few more tidbits that we'll throw in along the way. And skill number 1, probably the most important for me, is process of elimination. And you'll hear people talk about that a lot. And I think the benefit for this is that it's really versatile. You can use it for any type of question that you're going to encounter. You can even use it to double check questions that you feel confident about, meaning that even if I know right away that, the answer is B, I can work through my other answer choices and say, well, A is wrong because of this. C is wrong because of this. I also think that using process of elimination is going to make you faster. It's going to make you more efficient rather than just sitting there staring at the question, hoping that something jumps out to you. You're going to have a framework that you can instantly jump into and say, hey, I don't know what's going on. Let me start working through some of these answers. Let me get rid of things that I know are wrong. Let me start narrowing down what, makes the most sense. It can also help you catch mistakes. Myself, a lot of times going through questions, as I go through and start trying to eliminate answer choices, I realize, hey, maybe this one actually did make more sense than I thought it did. And then Finally, I think during your study period, it can really help assess your knowledge and make you a more efficient studier. If I can go through and say, I know this answer is wrong because of X, Y, and Z. Here's what would have needed to change for it to become right. That kind of tells me that I'm pretty good at that topic and I'm not going to need to spend a lot of time reading the explanation for it. And I'm certainly not going to need to spend much time going and, looking at any other resources there. To apply process of elimination, I think there's a couple things that you have to make sure that you can do and that you stay, on top of. And we'll show that here in an example in a second. But I think first and foremost, you've got to be able to go through the question stem and identify the key variables. That's going to be pertinent positives, pertinent negatives. And I think right away, people failing to do that is where this can go awry. And, it doesn't work if you're only focusing on one detail in the stem. Another thing you're going to have to do is for the second and third order questions, like we saw last time, you're going to have to convert the answer choices over and say, okay, B is talking about the mechanism of hemochromatosis. D is talking about the mechanism of Wilson's disease, and so on. And then I think from there, you still have to have a good framework where you're able to say, okay, the first time I go through the answers, I'm getting rid of the bad ones, then I'm narrowing it. And I've always called that when I'm tutoring people, it's like sensitivity and specificity. The first time I look through my answers, I'm really just trying to rule the bad ones out. And I've always said, if I have to look at the answer for more than 5 or 6 seconds and I can't get rid of it, that first time through, I'm just going to leave that. And then what I'm hoping is that at the end, the specificity part, I can go down and maybe I only have 2 answer choices left that I have to think about. And I'm really able to use my brain power and my time to work through those answer choices that are most likely to be correct. So we can look over here at these questions, and you can kind of read through it a little quickly, here. And what we're trying to do is, first and foremost, just highlight the key variables here. So we look at this question. Again, I like starting at the end with the last sentence, kind of taking a look at my answer choices. And we see they want me to make a diagnosis. And we see that it's mostly going to be, GI type diagnoses, aspiration pneumonia, thrown in there. And as I read through the question, I'm really trying to highlight the key variables that are going to help me answer this correctly. And the way I've always told people to do this is think about it like this. If I took away everything but the key details that have been highlighted, I should be able to answer that question correctly. If you have accomplished that, then you're on a really good track at identifying these variables. If you're finding that, well, I only highlighted 1 or 2 variables, you're probably not doing enough and you're going to miss something that might be crucial. On the other hand, if you're highlighting every single thing and you've got, 15, 16 details that you have to work through, chances are you've done too much and you're going to get a little overwhelmed. So in this vignette, what we see is that our key variables are, we have chest pain that radiates to the back in this patient. We have symptoms that began after some forced vomiting because of our history of bulimia. We've got a medical history that says some risk factors for multiple things. The vomiting might make us think esophageal perf. The hypertension could make us think aortic dissection. The alcohol use could make us think about a couple different answer choices here. And then as we look through, as we move on, we've got fever. We have, a mildly decreased blood pressure with no difference between the extremities. Pausing on that for a second, again, you're seeing that we're making the decisions about what's important based on my answer choices that I'm dealing with. That blood pressure being symmetric between extremities points away from aortic dissection. The fever being there points away from dissection. And we can see a few more key variables there, normal cardiac auscultation, non-tender abdomen, high serum amylase, unilateral pleural effusion with a high amylase content. And what I'm really trying to stress is that you can see that we've identified these variables, relative to the answer choices that we have, and it's pertinent positives that are going to help us think through. And yeah, you see down at the bottom right-hand corner, one of the things I've tagged is that I think when you're doing this, you always want to prioritize the most objective variables first when you're thinking through things. So what I mean by that is like, I'll say it's like things that have a hard time, not being black and white for the test. So here we think about that fever, that is going to have to line up with my answer choice that I'm dealing with here. I'm not going to have aortic dissection as a correct answer because it can't explain the fever. Whereas we look at the patient's hypertension and we can say, hey, that's okay. The answer choice does not necessarily have to be able to encompass that, risk factor, because as we've seen, she has risk factors that line up with a lot of the answer choices. Clearly, only one or two might end up being relevant here. Once we've identified those key variables, we could be at a point where we would say, hey, either A, I know this, and I'm just using process of elimination quickly to double check myself, make sure I'm not missing anything, or B, I'm not really sure, let me start thinking about the answer choices here. So I'm going to put myself in the latter category on this one. And here's what I would do. I would say, okay, acute pancreatitis. What are the reasons that I could get rid of this? Remember, it's sensitivity. Let's rule answers out, and then we can focus on specificity. So, well, acute pancreatitis, there's no abdominal pain. She doesn't drink that much alcohol. She only drinks 2 to 3 glasses of wine a week, sometimes a little bit more. Acute pancreatitis doesn't usually present with such a high fever on the test, and she only has 2 hours of symptoms. Doesn't really line up. Aortic dissection would have probably been a very tempting wrong answer because of that buzzword, chest pain radiating to the back, but it doesn't explain the fever. It doesn't explain the pleural fluid with a high amylase content. Most questions about aortic dissection will have them present with hypertension in the stem. So we're not seeing that there with this blood pressure of 100, 105 systolic. Aspiration pneumonia. Pain radiating to the back is atypical. Chest x-ray would be more likely to show an infiltrate, usually in the right middle or right lower lobe, not a pleural effusion. And again, it couldn't explain the amylase count. For chylothorax, no real risk factors there, no trauma, no surgery. And then we see for Mallory-Weiss syndrome, while it certainly could fit with vomiting, Mallory-Weiss syndrome is typically self-limiting, painful hematemesis. It wouldn't explain the fever and just wouldn't explain them being this sick. And that's where we're left with esophageal perf. We've got a risk factor. It fits the acuity. It fits the symptoms. It fits the fever. It fits the pleural effusion with the high amylase content and works, really well there. What you're going to see as you do this is it's not going to be as black and white as it was with me explaining it to you. And there's going to be times where this feels really easy. There's going to be times where it feels, really hard. I think some of the pitfalls that I see is that, people maybe get hung up on something that they don't know very well. They get hung up on the amylase content and the pleural fluid. There's things you can start working on. I would always tell people, skip it. Let's take that variable away and focus on the other details there. And ideally, you could still come back and say, well, I'm not sure if this answer explains the amylase, but it's the only answer that could explain the fever, that fits with the risk factor, that also fits, with the acuity of her presentation. So I think at times you're going to have to live with a little bit of uncertainty there and, pick the answer that fits as many variables as you can reasonably work yourself through. Another issue that I see people run into is they tend to make information up and they try to jump through little steps to make things fit. And, I would always say if you're having to go through 4 or 5 hoops or you're having to add in a lot of details to get that answer to be correct, usually that's not going to work out very well. And then again, I think another big one is people have a hard time maybe picking up on distractors. And, we'll say here, not every question that mentions someone was in Maine, means that the answer is going to be Lyme disease. And, again, you see this back here where the patient really had risk factors that could have lined up with multiple answer choices. So you do have to be able to accept that not every single risk factor is going to be able to tie into the correct answer. There can only be, one correct answer choice, there. And then the last big thing I see people run into when we're doing questions, together is just, what if you eliminate everything? You go through and, you've gotten rid of all the answers. That's where I would tell people to open things up and usually start by opening up, based on answers you got rid of for the most flimsy of reasons. If you said, well, I'm not picking sarcoidosis because that's typically tested in women. Well, that gender stereotype isn't that great. There's lots of sarcoidosis questions that feature men as patients. That's not a good reason. Or, I got rid of this question because, the patient was 45 and I thought most of the time that happened in people that were 50 or 60. That's where I would really start opening answers back up versus answers where I was like, well, I got rid of this because it wouldn't account for the patient's fever. It wouldn't account for this lab finding. Those are usually ones that'll, probably stay, incorrect there. So process of elimination. The thing I would stress is if you're going to take away one thing from today, that would probably be the one skill that I would start working on now. All right, so moving on to the next one, skill number 2 for me, I like to call this working backwards. And we talked about it briefly at our last presentation, but with this one, I think is something very helpful that you can do for second and third order questions, especially if you find that you're struggling with determining the diagnosis. And I came up with this because students would always say, well, I just can't do this question because I don't even know what the diagnosis is. How could I pick the pathophysiology? And you realize, well, I can take advantage of the fact that this is a multiple choice test. Let's say, I have answer choices that are presented as biopsy findings. I can take a step back and say, well, what biopsy does this describe? Okay. Then I can go back to my stem and say, okay, well, does the stem sound like this diagnosis? I can do that for, all my other answers too. Same thing on my next bullet point, okay, the question is asking something about treatment. I can look at the drugs and say, okay, what would this antibiotic be used to treat? Okay, does this sound like the condition that I'm dealing with here? Same thing for, laboratory findings. I can work backwards with that. And to me, that's, the nicest thing about this being a multiple choice test is that you can use those clues oftentimes to help fill in your knowledge and help you focus on what you do know. So we look over here and, again, starting on our, last, sentence first, we see this question is going to ask about what's the most appropriate treatment for this patient's, current condition. Again, I can scroll through my answer choices and I can kind of get a feel that this is probably going to be a GI question just based on, how my answer choices are lined up. And if we're thinking about working backwards, I can say, through the examples, I see, amitriptyline's a TCA. I can use that for IBS. Cholestyrame's a bile acid resin. I can use that for bile acid malabsorption, and so on for each of these answer choices. So right away, I've given myself a huge advantage. Before I've even read the stem, I know the direction that the question's going to go. It's a GI question. I know the most likely diagnoses that I'm dealing with. We've got IBS, we've got bile acid malabsorption, we've got celiac disease, we've got, loperamide as kind of a catch-all that could cover a lot of things. We've got, chronic pancreatitis, pancreatic insufficiency, and then we've got, ursodeoxycholic acid, which is more of, biliary disease and PBC. Now I can go back up and focus on, okay, what details in my stem help point me towards an answer choice here? So again, let's just look at what we've highlighted. We've got somebody with 2 months of diarrhea, They're having non-bloody bowel movements every day. There's no fecal incontinence, but sometimes these bowel movements awaken her at night. The diarrhea occurs even when she's not eating. There's some bloating, but nothing else really there. 3 months ago, we see that there was an lap chole for management of cholecystitis. Vital signs are normal. We have a low stool osmotic gap, and now we can think about, treatment from there. And you can see on the next slide that we're just combining that with what we just learned with process of elimination. I can say, okay, I can get rid of my IBS answers because this isn't a typical IBS stem. IBS stems are patients with abdominal pain that improve with defecation. They usually have a normal stool osmotic gap. Celiac disease doesn't make sense because it would not have diarrhea that persists when fasting. It would be much more triggered by gluten-containing foods. Also, celiac disease is an osmotic diarrhea and should have a high stool osmotic gap. We see that there's no risk factors for pancreatic insufficiency. She's not an alcoholic. She doesn't have cystic fibrosis. And we also know that pancreatic insufficiency diarrhea would have a high osmotic gap. And then, this is more of a diarrhea question, so we really don't need to consider ursodeoxycholic acid. So, that helps me get rid of a lot of the wrong answers, and then we can focus in on cholestyramine and say, okay, my patient has, a risk factor for bile acid diarrhea. The symptoms began very much shortly after this, lap chole, so that fits with it. Bile acid malabsorption gives me a secretory diarrhea, so that fits my low osmotic gap that I'm dealing with. And when I'm dealing with secretory diarrhea, that explains why you're going to have persistent symptoms even when you're not eating, even when you're sleeping. So I've been able to kind of use that starting point to really work backwards. And you're not always going to have to do that. There are going to be a lot of people that could have went through this stem and, right away figured out the answer choices. But if you can't, and really when you find a question that you can't, this is something that you can do. You can take advantage and work backwards. Again, for each of these, we're going to try to talk just briefly about some of the pitfalls. One of the ones that I tend to see here is people just spending too much time trying to make each conversion and maybe getting a little panicked, when they can't. Again, if you can't do the conversion in, more than 4 or 5 seconds, just skip it and move on. It might come to you later. Another thing that I'll see people do is they just have a hard time keeping the conversions relative to the question that's being asked. That would be somebody going back over here and saying, well, amitriptyline can also be used for neuropathic pain. It can be used for this. It can be used for this. So again, it highlights the importance of practice, because I think that's how you become able to tell what is and isn't important, on those conversions there. Just something you need to keep working on that. All right, moving on to skill number 3. And this to me is, I know when I was taking step 1, I was always very much worried about the matrix style questions. Or you'll hear people say up, down arrow questions, the questions with lots of columns. And I think these questions can feel really daunting at first, but if you practice, if you develop a formula and approach for how you're going to do these, then I think they can become a lot simpler for you, or at least something where you don't, panic with them. What I like to do for these is I try to first make a mental summary of what's going on and what's being asked of me. Here are the variables that I need to consider. Here's what I need to focus on. I like to think about what I do and don't know, with regards to each variable. Knowing that these questions tend to be, pathophys, pathopharm type questions, I really like trying to think about the variables in terms of a cause and effect relationship in the order that it flows. So if I have, renin, angiotensin 2, aldosterone as my variables, I'm really trying to think about my RAS system in that normal physiologic order, how the disease state might change it, how the variables might flow together. And then when it comes time to answer, I always like starting with the variable that I'm most comfortable with and working towards the one that I'm least comfortable with. Because a lot of times I have found that you can maybe get the correct answer by just knowing 2 or 3 out of the 4 or 5 columns. And a lot of times you might not even need to worry about that variable that you struggle with. So we look over here, and my first step is I'm just taking a look at the variables. I see we're talking about afferent arterial, ADH, renal sodium retention, ANP. So I kind of have an idea of what's going on. And we read this stem, and briefly, it's 82-year-old, 2 weeks of shortness of breath and cough. He's got some orthopnea. Patient has a history of MI, not compliant with pharmacotherapy. We see pitting edema, evidence of pulmonary edema, the S3. So my first step is really asking myself, how are these variables going to change in decompensated heart failure? I've made this as direct of a question as possible here. The next thing that I'm going to do is just start thinking about normal physiology and pathophys as it pertains to the variable. So I can say, okay, with decompensated heart failure, I have decreased cardiac output. That's giving me decreased renal perfusion, and that's giving me RAS activation. If I have RAS activation, aldosterone is going to increase my renal sodium reabsorption. It's going to stimulate ADH release. Angiotensin 2 is going to cause vasoconstriction of the efferent. And then lastly, I know right away, ANP is a marker of heart failure. I know it should be elevated. And I know that's because the increased volume is stretching the heart and causing that release. So I'm going into this question with a pretty good understanding of that physiology. And then, from there, I can work towards my answer choice. And, it's whatever variable you want to start with. I could look over at ANP and say, hey, that's where I'm most comfortable. I know it's always up with these heart failure patients, so I can get rid of C, E, and F off the bat. Then I can start thinking through and say, okay, well, if aldosterone is going to be elevated, then renal sodium retention should be up, and I should also be making more ADH. And if I'm activating my RAS system, then, angiotensin 2 is causing, constriction of the efferent. So, you got to practice with this. You got to start working on it right away. But I think the more you can do to practice these skills on these questions, then the more natural it's going to feel as times go on. Some struggles here. I alluded to one already, and it's just that you can often answer without knowing all of the variables. And I'll see people mess up because they'll be able to work their way down to just one answer remaining, but then they'll go to the variable that they don't understand and then, start changing things based on that. You're better off always focusing on what you do know. Another problem is just people, the opposite side of that, where they're not double checking and they don't go in and realize, hey, I actually do understand this variable, and this might be the only answer choice left, but it doesn't line up. That should be a sign that you need to go back. And then from there too, I think people can sometimes take things too far on these. And the example I would get is think about acid-base stuff. When we have metabolic acidosis, we compensate by hyperventilating to decrease the PaCO2, but we're still going to be acidotic. That's not going to take us to the other side and make us alkalotic. And I see people miss that because they, almost end up in a loop where they push it too far to the other side. So, practice makes perfect there. All right. All right, next skill here, paying very close attention to specific wording in the stems. And, what I've seen, through the years is that you can often have, an almost identical question, and all you have to do is make a slight little change to the end, and it can very much impact what is and isn't correct. And a lot of times people are missing questions simply because they're not paying close enough attention to the exact wording. So if we look at these, we're dealing with two question stems that are both very suggestive of lupus. You guys can go back and look at the slides later and, read all the details in here. But what we see that the real difference is look at what's being asked in the very last sentence. For the question on top, the question is focused on what is the most appropriate initial step in the evaluation of the patient, whereas the question on the bottom is asking for a finding that is most specific for her disease. Those are two very different questions, because we know that for lupus, when we think about initial workup, we are focused on sensitivity. We are trying to focus on ruling it out. And that's why you're going to start with ANAs for those patients. If my ANA is negative, I'm going to feel pretty good about ruling lupus out. However, I know it's not very specific and I would need to do more testing. So the best initial step for looking at somebody with lupus is the ANA. But if the question lead in is switched and it's focused on something that is more specific, then the better answer becomes antibodies against double-stranded DNA, anti-Smith antibodies. And over and over again, I see people miss these questions because oftentimes I think they're just rushing through it too fast. They think they know what is being asked. And, I remember this last question I saw on lupus, diagnostic evaluation, and the answer was ANA. And they're just not paying enough attention to, the exact details. And again, a similar finding could be seen with RA, where, rheumatoid factor is, sensitive. The anti-CCP antibodies are very specific. You can also use this, the wording for process of elimination. If I see a question lead in that says, which of these findings is most specific for her disease, without reading another word, I should at least be able to go through and get rid of any answer choice that I know would not be specific for any given disease. If this wouldn't be seen with just one condition, I should be able to go through and get rid of that. For, looking at the bottom example, I could say, okay, well, it's not going to be E because ANA is seen with too many things. It's not going to be D because rheumatoid factor is seen with too many things. It's not going to be B because lots of diseases have a low albumin. It's not going to be A because lots of diseases have low complement. I mean, without even reading that question, just the wording alone told me that C would be the only answer that could be correct there. That's a great test taking skill when you can figure that out. Some other things to focus on with wording, you can see this with drug mechanisms. We think about digoxin. A question asking for the direct mechanism wants you to pick inhibition of the sodium-potassium pump. But if it's focused on where are the beneficial effects coming from, then it's really more related to the indirect inhibition of the sodium-calcium exchanger, because that increased calcium is really where the benefits come from. Same thing here for disease pathophysiology. Something asking me about the underlying pathophys of acromegaly wants me to pick growth hormone, producing tumor from the pituitary. But if you're asking me where are the symptoms directly coming from, then that's going to be related to the IGF-1 from the liver. So you just want to pay really close attention to the exact wording. And, I think step one is just being able to catch that wording differences and answer appropriately. The next skill, the next level up from that is when you can go and say, hey, I can eliminate a lot of these answers just based on the wording alone. Moving over to the next skill, a big one that I always tell people is just focusing on what you do know as opposed to getting caught up in what you don't. And I think a lot of times, where people really start hurting themselves is how they approach questions where they don't immediately know what's going on. And the best thing you can do is take a deep breath, take a step back, and start focusing on what you do know. What are the buzzwords that I typically see for this? When I've done question banks, how has this disease shown up? What details here stick out to me? And I think a lot of times, just by focusing on your existing knowledge base, you'll be able to work through a question stem, and you'll be able to work your way towards the answer choice here. So, sticking with kind of a, lupus exam here, this question's asking me, what's going to be seen on microscopic analysis of the urine for somebody with lupus? Again, everybody's different. There are going to be people who right away could jump to the correct answer choice. But if you can't, what could you do? I could take a step back and say, okay, well, what do I know about these urinalysis findings? I know that eosinophils, from what I've seen, are usually questions about, AIN. That's not really tied to lupus. The granular muddy brown casts are usually with ATN. That's not tied to lupus. Luke esterase is a UTI associated finding, doesn't really line up here. White blood cell casts go with interstitial nephritis, acute pyelo, acute transplant rejection. So just focusing on that existing knowledge can help me rule out a lot of the wrong answers. And then again, ideally, I'm left with, that piece where I can say, well, red blood cell casts are usually with nephritic diseases. I know diffuse proliferative glomerulonephritis can be seen with lupus. That's a nephritic disease. And I'm able to line that up. So again, best world, perfect world is that you just read through this, you immediately picked up it was lupus, and then you immediately knew that it was red blood cell casts. But even if you didn't, slow down, focus on what you know, and let that help you, out there. Here's some other things here. You can oftentimes link this to pathophys and treatment, type questions. So let's say I'm dealing with a, typical variant vasospastic angina question, and they're focused on treatments. I can say, okay, well, I know that the pathophys on this disease is vasospasm. Vasospasm is happening as a result of smooth muscle contraction. It would stand to reason that the best treatment would be a drug that's going to cause smooth muscle relaxation, a nitrate, a calcium channel blocker. Similarly, you can use your existing knowledge to predict laboratory findings. I can say, okay, when I have someone with ATN in that initial phase, ischemic injury is going to prevent the normal function of the tubules. Let me take a step back. What is that normal function? Well, the tubules normally act to save sodium. So if that means they're not working, that means I'm going to have less sodium reabsorption in the kidneys. My urine sodium should be elevated. My FeNO will be elevated. I also can say, hey, I know the tubules normally act to secrete potassium. If that's not happening, this patient should have an elevated serum potassium. I might not have known that immediately off the top of my head, but slowing down, taking a step back, focusing on what I do know can help me work towards that correct answer. And again, at the end of the day, nobody knows why you answered a question correctly. They don't know if you 100% knew the concept, if you just blindly guessed, or if it was something in the middle. All that matters on this test, a multiple choice test, is that you were able to get the answer correct. And, again, the best way to do that is combining knowledge with good test taking skills. A few other bonus things that I wanted to cover here, just things that I find myself saying to students a lot. First and foremost, most questions are not trying to trick you. I think it's very easy to go through, question banks and feel like there is always a trick there. And, what I found through the years is that you would honestly miss less questions if you came in with the mindset that they are never, ever trying to trick me, versus the person who is always suspecting a trick question. And I've just seen so many people miss things that they know because they feel like they're always trying to find a trick. So will there be a few trick questions? Absolutely. But it's not going to be the majority. So I think if you're someone who is really finding that you change a lot of answers from right to wrong. You find yourself always saying, well, what if this is wrong? Or what if this trick is there? I would almost tell you to take a step back for a little bit and say, for the next few weeks, I'm going to approach this as if they are never trying to trick me. And I bet your score would go up. And when you're doing that, like if you're having to take 5 or 6 steps, or you're having to jump through all these obscure hoops, or you're having to think, well, maybe this is some crazy atypical presentation of the disease, it's just not going to be, right. I mean, step 1 focuses on very typical presentations. You're not usually having to take 5, 6 steps down the road to get to that correct answer. Next point here, really be on the lookout for distractors. We mentioned this in, process of elimination earlier. And you just got to remember, not every detail is going to be able to tie into the correct answer. And some of it is there to kind of make you use knowledge points and differentiate. Don't let the patient being, in Maine be the only reason that you pick, Lyme disease. Don't let a family history of, cirrhosis be the only reason that you pick alpha-1 antitrypsin deficiency. I've literally seen questions where they say, oh, the patient's dad died of alcoholic cirrhosis, and 20% of students still go pick, alpha-1 antitrypsin deficiency for the answer. And they almost outright told me that it wasn't inherited; it was an alcohol issue. And then same thing for medications. Not every single question would tie into a drug side effect. And, if I notice they've been on the meds for years, it's probably a good chance that, drug side effect is going to be the wrong answer there. Again, it just takes practice. You've got to find your, way of doing questions and, catching these things. Another big pearl: learn to focus on objective versus subjective variables. I kind of came up with that term myself. And the way I look at it is, like, to me, objective findings are like things that just are going to be very black and white on the test, biopsy results, imaging results, exam findings, etc. If they tell me antimitochondrial antibodies are positive, I know it's going to be PBC. There's not a scenario for the test where AMA is positive and, that doesn't line up there. The flip side to me are the subjective things: age, risk factors, non-specific things. These are the ones to me where it's a lot easier to overlook them. And, hey, you don't want to miss a question because you're like, well, they said antimitochondrial antibodies are positive, but I don't know. I don't really know if PBC would cause fatigue or not. That would not be a good reason to not pick that answer choice. So I think as you're working through process of elimination, really try to say, hey, these are the, really objective findings that I know I have to account for. Focus on that first, and let those be the things that really guide your answer, not the ones that are a little bit more subjective there. The other big one here, don't be overly fixated on generalizations. I think we've really moved past a point where you're going to be able to rule answer choices in and out based on gender and race. There are exceptions, but again, like when I went through step 1, it was like every sarcoidosis question, was featuring a young woman. And, the reality is sarcoidosis can affect lots of other people, and the test is adjusted. And, I think you want to make sure that you're not using some of those biases one way or another. Don't rule out sarcoidosis just because it's a male patient. Don't rule in sarcoidosis just because it's a young woman with a cough. Going along with that too, you want to keep in mind that the presentations for diseases can be variable. Esophageal perforation, the x-ray might show mediastinal widening, it might show pleural effusion, it might show both. Learn to make that mental bank of everything that could possibly be there, and realize that you're probably just going to see some combination of it. And again, that's where I see a lot of people go wrong, is that they just feel like, every question about von Willebrand's disease is going to have the prolonged PTT. And it's like, no, it's going to depend on the severity. The prolonged bleeding time will always be there. The normal platelet count will always be there. But I know in terms of the PTT, it could be one of two options. If it's not that severe, it could be normal. If it's very severe, it could be elevated. So learn to, find those differences and not be fixated. And then the last one here, really learn to play the game. And, the USMLE is not like real life. And a lot of times it is very focused on buzzwords. And, there are just buzzword stems that you can learn. A patient with leukemia plus features of DIC is going to be an AML question. A little kid with signs of leukemia is going to be an ALL question. Someone with waxing and waning painless lymphadenopathy, it's a follicular lymphoma question. These kind of generalizations are not necessarily going to make you a good doctor. It's not going to be how medicine is actually practiced, but it is going to help you with the test. And, I think realizing when it's appropriate to do that is a very easy way to help your score. So wrapping up here and, leaving some time for questions, I think start practicing your test taking skills right now. Again, with the, fail rate rising for step one, I think it really highlights that you still need to take this test seriously. You still need to give yourself enough time to study. You still need to really focus on doing questions, getting that exposure and building your skills. Start working on these test taking, tidbits, and, really figure out, how can I do process of elimination? How do I work backwards? How do I, focus on knowledge, making sure that you're reading stems the right way. These are all the things that you want to do, right now. And, we've included some links to some additional resources on here, as well as our, next webinar. And I'm going to kick it back over to, Ben here, and, let him help with the wrap up too. And, then answer some questions that you guys have, put in for us.
Thank you, Dr. Carrubba. Yeah, we'll go to some questions that have come in. Some of these were from the last session as well. We weren't able to get to last time. So the first question is, how might some of this information, for example, test taking strategies, differ for step 2 CK? Any different focuses or tips or variables you'd add to the mix?
Differs so much as it builds. And, I think that is just another reason to really start working on them, because test taking skills becomes a huge component for step 2. And I think with step 1, you can certainly get by just having a good foundation of knowledge. It is a little bit, and certainly the test taking skills are very helpful, but I've certainly met students who don't want to work on that, really just want to focus on knowledge points, and they're able to get by. But step 2 becomes a lot more like real clinical practice. And I think it becomes much more of a critical thinking test. And I think that the people who don't want to work on test taking skills or have a hard time with that for step 1 really struggle when they switch over to shelf exams in step 2, just because of how important that stuff is. So I don't think that it's different. I just think that it builds. It's like going from, college basketball to the NBA. It's just, a much more important skill set. It's a little bit more challenging how it, goes. And I think it's at a point where you really have to practice a lot more, especially if you didn't use step 1 to, build that foundation.
Great. Another question is, how early in the process do you recommend taking an assessment, and what should you do, or what kind of remedial action should you take based on the results of an assessment?
It's really different from everybody. I mean, I think I would say that at a bare minimum, you should take an assessment when you're starting your dedicated study period. I think before that, it's a little variable. I'm not a huge fan of it. Doing it too far before dedicated, just because my attitude is always, I want to get something out of that, the results from that. And if I'm able to say, well, the results are bad because I've not even really studied, there's subjects that I haven't seen for months or, maybe even over a year, that's not going to be very helpful for me. So, at least starting it at the beginning of dedicated, I can at least say like, hey, this is giving me at least just a quick snapshot of where I'm starting from. It can give me a little bit of insight into what I'm actually bad at, because a lot of times we're not very good at figuring that out on our own. I see a lot of students say, oh, I'm going to be terrible at micro and I'm great at path. And the, results say the opposite of that. So that's probably where I would recommend starting as a maybe blanket catch-all statement is take your first one at the beginning of, dedicated. I think for that first one, what you want to focus on are what are my weak areas? What are my strong areas? What are the things that I think I'm probably going to need to see a lot to do well? What's the low-hanging fruit for me? What are the easiest ways for me to make a big improvement in my score? What are those high yield areas that I'm not very good at, but wouldn't take a lot of effort to learn and are going to make a big difference? And then I think as you go, again, it depends on how much time you're giving yourself, but getting to a point where you're taking a practice test every week, every other week as your exam comes up is certainly good. And again, you can use those at that point to say, here's the things I'm still bad at. Let me fix them now. Move on to the next week, repeat that process over and over again.
Thank you. Another question that just came in, and maybe this is kind of a wellness question, so maybe speak to the idea of wellness in general, but how many hours of sleep is needed during the dedicated study period? I'm not sleeping a lot. So, maybe speaking to, making sure you get the right amount of sleep, wellness, staying on your game when you're going through this difficult period.
Yeah, I'm a big proponent of wellness on this. I mean, I would tell you, again, it comes back to it's a marathon, not a sprint. I would absolutely be trying my best to get, somewhere between 7 and 9 hours of sleep a night. It's just, it's diminishing returns at a certain point. And I have never encountered a situation where it's like, if only they had studied, 12 hours a day instead of 8. At a certain point, you're really not getting that return of investment on your hours. And what's going to start really creeping in is that sleep deficit, that fatigue. And rather than, putting in 6 to 8 very good focused hours, you're putting in 12 exhausted hours, which maybe really only amounts to 3 or 4 quality ones. So I would absolutely encourage you to focus on the wellness, make sure you're getting the sleep, take a day off if you need to. I think that is fine. I think it is always better to say, I need to take today off. And in doing so, I'm going to come back stronger tomorrow and I'm going to be very productive tomorrow compared to I'm going to power through. I'm going to power through. I'm going to power through. And, what you're seeing is that your productivity as you're powering through, tapers down like that over time versus, maybe that person that took a day off was like here, boop, here, and then they're back up again. So absolutely focus on that wellness component.
Thank you, Dr. Carrubba. Another question. If I'm weak at content, can doing a QBank substitute for content review? I find it too passive and not able to retain information effectively from that content review.
Yeah, I mean, I think again, I can speak for our question bank the best. We are putting in everything that you need to answer that question correctly. So if you missed it, the explanations that we have there, both for the right answer, for the wrong answer, are really covering everything that you would have needed to know there. So I think absolutely a question bank is, at least ours, and again, UWorld as well, are good for content review. And going back to the first session, I think that's where I would say, like, you really should approach the question banks as a learning resource, even more so than an assessment one. So absolutely. And, I would say if you've tried other banks and haven't felt that way, definitely try ours, because I do really stand by that. We've made it so that if you read the explanations, if you read the wrong explanations, if you read the insight, we're giving you everything you need to know on that topic.
Thank you, Dr. Carrubba. Another question. If I'm poor in anatomy, what can I do to strengthen that well and dedicated period?
Again, I would say start with questions. Anatomy is such a broad subject that it's like one of those where, again, I'll see people, they like sit down and they're looking at netters during dedicated. Maybe they're going back to their class notes. I think question banks are going to give you a really good guide as to what is going to be tested. And what I really would say is that my starting point would be going through a bank and making sure that I feel really good about all the concepts in it. Again, especially the ones that I'm seeing 50% or more of people answer correctly. So I'm going to use that bank to figure out what is actually important to know. And again, really use the explanations that are there to get that, because I think if you go away from that, you're just going to spend a lot of time on low yield things and like, where does this ligament originate from and attach to? That kind of stuff just doesn't get tested very much. So I think the banks serve as a really good guide as to what's high yield and, what to focus on. Thinking about specific stuff, I would say if you wanted a starting point today, I would think about like upper and lower extremity nerve injuries, some anatomical stuff related to like surgical complications, injury to like the recurrent laryngeal nerve during, thyroid surgery, something like that. Different dermatomes. Those are some high yield ones that I know definitely come up. But I mean, again, I think if your bank is covering it, that's probably the stuff I would focus on first.
Thank you. Another question: how do I improve test taking strategies or get better at the test taking skills beyond just doing questions?
I don't think that I don't want to say this. It's not necessarily beyond doing the questions. To me, it's how you approach the questions. And, echoing back to that first webinar we had, it's really thinking about like the question in terms of like, what did I need to know to get this right? How should I have approached this question? Is there a way that I could have looked at it differently? And then working through some of those things that we've, talked about. I mean, it's like one of those where it's like, how do I get better at playing basketball? I go play basketball. And I think you have to do that for test taking skills. I'm not going to get better at it just by passively reading in a book. To get better at test taking skills, I'm going to have to do questions, and I'm probably going to have to do questions on timed mode and really try to mimic, that real situation. Otherwise, you can definitely start to look into some learning strategies. I know we had TrueLearn put on a webinar, with one of our physicians recently that talked about some advanced adult learning strategies, and that kind of stuff certainly can help. Especially if you like learning theory, and that's something that echoes, for you. I'd encourage you to look that up. But otherwise, it's one of those where I think you do have to go in and do a lot of questions to make that improvement.
Thank you. And another question: if I'm stuck at the same score and I haven't reached a passing score, what tips would you provide for me?
It's really hard. Honestly, that one's really hard to answer without knowing you, a little bit more specifically. Um, yeah, I don't know. That's a hard one to do. I would tell you, trying to give you the best generalized advice here. I would tell you to take a practice test, really sit down with that practice test and look for, where your problems are, and maybe compare that to some of your most recent ones. What are the trends that are there? My guess is that there's probably some pretty consistent trends there. Consider even reaching out to somebody, a friend, a mentor, somebody at your school, and asking them to look at it with you, and getting a feel for that. And, I think as you maybe go back through that practice test, ask yourself some of the questions we talked about in webinar 1. Why did I miss this question? What were the learning objectives? And see if you can, focus on some of that stuff.
Great. Thank you, Dr. Carrubba. We are just about at time. So if any other questions we'll address in our next chat. But with that, we're going to wrap it up. So I'll hand it over to my colleague, Ben here, to give our final few words.
Absolutely. So thank you, Dr. Carrubba, and thanks to everyone for attending Beyond the Basics Session 2 of the 2023 USMLE Step 1 Tutor Series. Few final notes: within 24 hours, you will receive a follow-up email containing a replay link to a recording of tonight's session, along with the option to download the entire slide deck as well. Additionally, this email will contain an exclusive offer code good towards any USMLE Step 1 Smart Bank or bundle. And of course, TrueLearn does offer a completely free Smart Bank trial that you can access simply by visiting TrueLearn.com and navigating to the USMLE Step 1 product. Lastly, if you haven't already done so, do mark your calendars for Session 3. This is our final session, titled From Skill to Mastery. You won't want to miss it. It takes place on Tuesday, May 2nd, same time, 8 p.m. Eastern. So on behalf of TrueLearn and our presenter, thank you so much for joining us, and you have a great rest of your evening.